as a result of what are the bases, how as an individual need to see the rising cost of health insurance, and then how Affordable Care Act is trying to reform the healthcare. This is a class that students will take in the medical billing and insurance specialist program. It is also a general class that they take as a result of being in the program. So we'll start our webinar. The learning objectives today is history of insurance in the United States, explain the reasons for rising cost, discuss how Affordable Care Act reforms healthcare, discuss the legal principles of insurance, and the four concepts. So basically, just a small webinar to just give you an idea of why having the knowledge and of medical billing is so important. Also, why medical billing and insurance specialists field is increasing. Um, so we'll start with the legal principles of health insurance. Insurance is one of the largest in industry businesses. Health insurance specifically offsets the cost of illness and or injury. It also helps an individual from medical costs that have would be increased otherwise if they didn't have the option. Patients may also have more than one insurance. So depending on where they are, how they work, their next insurance, they may have one or more insurance. How are we as an individual dealing with rising cost of health insurance? The federal government introduced three or four government insurances, which are known as Medicare, Medicaid, and TRICARE. Many new insurance plans then came into uh, into control in order to control the cost of medical care and help people who cannot afford medical care. Healthcare reform basically was a major reconstruction of healthcare system in the 1990s. This is when we had Patient Protection and Affordable Care Act. We also had Healthcare and Education Reconciliation Act. This is a topic that's been continuing uh, as long as we know United States came into being because Affordable Care Act uh, Americans to have a health insurance. The purpose of this is to allow them to be covered no matter what. So if they're not covered, then they would face a penalty. This is something that came in being in June 28 or 2012, and it's basically a fine for a person who doesn't have health insurance is 325 per individual or 2% of the taxable income. So in order to make it easier for people to have insurance, there are state-based American health benefit exchanges and small business health options. So basically, we have clearinghouses, we have small groups that help you to shop and also see which individuals can be covered and how they can be covered and what would be the prices for the coverage. So now the legal principle of insurance, basically the insurance is very important as for the following reasons. The person must be covered, and in order for them to be covered, the person has to be mentally competent and should not be under the influence of drugs or alcohol. Insurance company must make an offer by a signed application. The person must accept that offer and then pay for that amount. An exchange of value, meaning the premium is submitted. The person needs to know what the premium is and how much they will be paying. A legal purpose must exist, which is insurable interest in the case of a health insurance policy. So if you look at some statistics, the coverages of health insurance are of different types. You have competitive medical plan, disability insurance, income insurance, exclusive provider, foundation for medical care, health maintenance organization, individual practice association, independent or individual practice association, or maternal or child health care program. And you also have some which the purpose how we handle it is we manually prepare claims for submission, which is a HICFA CMS 1500 form. And then a lot of times physicians and hospitals will contract out of the hospital or the agency to complete the billing cycle. So if you see the insurance claim life cycle consists of four phases. You have phase one where patients make appointment, pre-registration, insurance information, HIPAA form is provided, patient signature is required, and then account assignments of benefits and financial accounts. Phase two is where medical services are performed and encounter form is completed. And phase three, where insurance claim is now electronic. At one point, it used to be done through fax and mail. Now, insurance claim forms are electronically created. Claims are transmitted. Provider signs the form. Tracking of the insurance claims are completed via medical software. This is where medical billers and insurance specialists come in existence, and this is where the importance is, because in order to run that software, you need to know insurance, you need to know healthcare, you need to know anatomy and physiology, you need to know the process and the and insurance claim process. And medical billers are the only ones who are able to do that. You also then the phase four cycle, which is care processing, payment is received, and then if the patient is covered 100%, he or she does not need to pay, or otherwise, if they have a deductible, this is where they send the deductible fees. It's mailed or emailed to them. This was a little bit about our process of insurance form. You, this was a webinar which is presented to you by Skokie Institute of Allied Health and Technology. Our purpose here was to just give you an idea of what is covered in our medical billing and insurance specialist program. Our spring registration is going on right now. In order to get get admission and get registered in this program, you need to call us at 847-461-3985, or you can email us at info@siaht.org. Right now, we have a special promotion going on. You register before April 6th to receive 40% off, 40% off tuition and a free tablet. This is for only for students who would be registering through our website. Our website is www.siaht.org. We look forward to assist you in our process. You can also follow us on our social media, and any questions, do not hesitate to call us. Thank you.